All right, so I'd like to call to order this subcommittee work session on House Bill 406 FN relative to parental access to children's medical records. The purpose of this subcommittee work session will be to make a recommendation to the full Health and Human Services and Elderly Affairs Committee, which will then make a recommendation on the bill to the House when it reconvenes in January. I guess I want to open by saying I've had the benefit of a number of conversations with hospital CIOs, risk and compliance officers, privacy and compliance officers at some of the healthcare providers in New Hampshire, and learned a lot throughout this process and really appreciate the opportunity to speak to those folks. As the prime sponsor of this bill, it's important to me that we empower parents and that we get parents the information that they need to be fully informed about their children's health and well-being. Having said that, I think we're also dealing with a myriad of requirements both at the federal and state level that make this a much more complex issue than it appears on the face of it. I would like to begin, if I may, by offering just kind of a summary of what I've learned throughout this process, and perhaps that will help to inform the rest of the committee in their thoughts on where we go with this. Specifically, the impetus for filing this bill arose from a parent who had received, and many parents have received a similar letter from one of the hospital systems in New Hampshire saying that your child is now age 12, you will no longer have access to their portal records. And this seemed to be seemed to me and to the parents in question to be kind of on an infringement on a parent's right to know what's happening with their child. In fact, HIPAA dictates that parents do have access to their children's medical records with certain exceptions. Those certain exceptions might include things like testing and treatment for sexually transmitted diseases, among other things. The same kinds of carve-outs apply at the state level. In fact, the ability to consent to testing and treatment for sexually transmitted diseases is a New Hampshire statute for, I'm pretty sure it's children age 16 and older. I may be wrong about that. It may be 14, but I think it's 16 and older. And that also applies to the privacy of those records. That creates a bit of a challenge for the medical providers, because if they're going to provide patient portal access, they now need to distinguish between that which is accessible to the patient versus that which is accessible to the parent. That means that their systems need to accommodate this kind of patchwork of various treatments, medications, and tests that might occur throughout the course of caring for that patient. For example, if a 16-year-old comes in and says, I think I may have a sexually transmitted disease, I want to get tested, the test and the treatment may have a flag in the record that says this is to remain private. The doctor or other provider caring for that patient now needs to check a box and make sure that that is flagged as private from the parents. If they fail to do so, it's a compliance issue. They've essentially violated the privacy of that minor child. And that was in the conversation I had with a hospital CIO the other day, it was possible to flag the record on treatment, but not on medication. So there was no flag on medication that the medication is to be kept private. So ultimately, there are changes that need to happen at the software level, and the software, typically we're talking about EMR, EHR, so electronic medical records, electronic health records, and these systems are, as far as I know, there are at least 8 different software vendors that are in use in the state of New Hampshire by various hospital systems. And so they're not only having to maintain those records, they also have portal software that then needs to be able to discern what to present to a parent versus what to present to a child. So this puts the hospitals in a kind of all or nothing situation. Either we can present everything or we can present nothing. And what they have chosen to do at this point is to say, starting at age 12, we're going to present nothing to the parents in order to comply with this patchwork of privacy restrictions that are in both federal and state law. So I'll stop there for a moment, and then I'll get into the information blocking rule. Are any questions or comments so far? Yes, Representative.
I should understand this by now, but I guess it just shows how complicated it is. So you're talking about the portal in particular, what information is available on the portal. But in general, in principle, once I thought a minor was down to 0, but I've just been informed that a minor is 12 to 17, and a child is younger than 12. But in any case, under federal law, under HIPAA, is it accurate to say that a parent cannot access a 12 to 17-year-old's records, medical records, without consent from the minor?
No, that's not accurate. It's so I was not trying to distinguish between a child and a minor. To me, I was using the terms interchangeably for anyone under 18. But the distinction is that they're under HIPAA, a parent does have the right to access their children's medical records with certain exceptions. So if a parent goes to a medical provider and says, I want a copy of my child's healthcare records, they will get them minus certain things that are restricted. So
okay, that was my previous understanding, but I guess maybe I misunderstood something.
And the problem is that the EHR, EMR systems and the portal software that is used to make that visible to patients is not able to distinguish what should be excluded from a parent's visibility versus what should be included. So the other development that we were watching when this bill was retained was what was happening at the federal level with something called the information blocking rule. And the information blocking rule, I believe, emerged out of the CARES Act, and it basically says that if a healthcare provider has records that a patient is entitled to see, and if the medical provider does something, let's say, to make it more difficult to access those records, that would be a violation of HIPAA or the spirit of HIPAA. And so the information blocking rule was, when we retained this bill, the information blocking rule was still sort of in discussion. How will this look in real life? What are they going to actually do? What will those regulations look like? There is a specific carve-out in what they have implemented at the federal level, acknowledging the fact that there are technical limitations currently in the software. Therefore, the information blocking rule has been deemed not to apply currently to this situation. That is, if hospitals simply say, we're turning off parental access at age 12, the federal regulators have acknowledged that the information blocking rule will not apply will not prevent them from making that decision because there are technical limitations which, in essence, compel them to make that decision.
But once again, just so I have this straight, when you say turning off access at age 12, you're talking about turning off access to the portals, not to the actual information itself.
Yes, turning off information to the portal. So I'll maybe give an example, which is, let's say you have a 17-year-old who's going in for a routine physical, or has, breaks their wrist or something like this, and they're going in for treatment. And, around the same time, they go to a physician and say, hey, I think I might have a sexually transmitted disease. I'd like to get tested. The law dictates that parents have access to the child's medical record, but the test for an STD or any subsequent treatment for the STD is not included in that. So in order for the hospitals to comply with the law, they either have to filter the information that's visible to a parent using the portal, which is not currently technically feasible for them, short of spending many millions of dollars on custom coding, or they need to say, look, if you want your child's medical record, you need to come in and request it and we will provide it to you. And when they provide it, they're going to pull out those things that are deemed to be private. They're going to pull out the record about the testing for STDs. Okay. Any further questions about what I've said? Yes, Representative Cushman.
Thank you. So I have a few issues with this. So having had worked with some of these big EMR systems like Epic, I know for a fact that it's very possible for them to have these systems changed to comply with rules. I remember, I think it was in 2020, maybe 2021, there were some rules coming down by October. Everything had to be switched over. And the person at the visiting nursing agency that I was working at, who works with Epic, was busy working with them and working out the kinks and figuring out what changes needed to be made. And, it was just accepted, and they worked on changing the software to comply with the rules that were coming down. And they had like 3 months to do it. So I sympathize with, that takes some work, but I know that these systems have the staff and, that it's totally possible to come into compliance with a law once it's been enacted, or when they know it's going to be enacted soon. So I could reach out to that person and get a little bit more information from her. I would like to see exactly what that process was for when they had to change that stuff, and maybe get some feedback for the next time we discuss this, or the full committee, or what have you. So that is a little troublesome. And then just still the idea that parents either have to have, parents who want to see their kids chart or see their kids' information, if the hospital or, facility says, or doctor's office says, we're just going to shut it off to you, then that parent has to go in person and get the records in person and pay for the copies. And I know that we discussed that already. I don't think that that's a fair burden to put on parents, because I had a call from a mom of 9, who wanted to get into her daughter's chart, and they would not give her any access. And this was on blood work. She wanted to know simple labs, what the labs results were, and the policy of the doctor's office was just, no, we don't allow you in. And then I was also looking, I was investigating this last night, and they've done some studies on these EMRs, and over 50% of them allow for proxy access. So it's like deliberately designed to give parents just the information that they're entitled to. Over 50% of them have that capability already. So I just don't see how it's so difficult. Maybe we can push the enactment date back to give them some time to comply. But as far as I see it, saying, oh, we don't have the technical ability and just throwing their hands up, it seems like there's a lot more to it than that, and that it is possible. Maybe they just need a little bit more time, but that's just my thoughts. Thank you.
Other comments, questions? Do any of our subject matter experts in the room have anything they'd like to add? Yes.
Thank you, Chairman, and members of the committee. For the record, Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association. I don't consider myself an expert, but I do represent the hospitals, and I have been talking with our members for months on this. So I appreciate Representative Cushman, Representative Kofalt, as far as your research that you have done and the willingness to talk with some of the hospital folks. That has, I think, been very helpful. Certainly, the hospitals have appreciated that, as have I. I think it is very complicated. Different systems, as Representative Cushman mentioned, Epic is a different system, a very, very expensive system, and not everyone has that. And their capabilities are different than a Cerner versus a Meditech or whatever else. So that is one of the challenges, and they are all working towards this, but they are just not there yet relative to the portal. And I think I just need to caution everyone. The EMR is not the portal, and I think a lot of people conflate the two. And access to the minor's medical record through the appropriate consents when necessary are certainly allowable, doable, happens all the time. And I think I've shared with the committee through Representative Kofalt some of the documentation for doing just that. It's the portal that I think is just the issue that has, I think, has come up during this whole debate. And I think Representative Kofalt has explained it very well, as far as it's an extraction of the EMR and trying to pull without violating HIPAA, which would be a federal problem, and compliance is very, very strict about this. The chances of the flags, we're talking about humans putting flags on and trying to make sure that that data does not get over to the portal inappropriately is a big, heavy lift. And I appreciate, Representative Cushman, your comments, but again, Epic is one system, and not even everyone that's on Epic has the same capabilities, because it is a lot of work. So what some hospitals have done is actually shut off the portal once the patient turns 12, so that they do not violate federal HIPAA laws. So So I just wanted to mention that. What we certainly, I think what has come out of all of this is more education, I think, which doesn't require legislation. There is certainly always an opportunity to provide more clarity to parents and to patients in general. And I think that is something that we have taken back and will take back and have further discussions, certainly with our hospitals, relative to what can be provided in a pediatrician's office, in the hospital's offices, not just pediatricians, but family docs as well, so that it's very clear what the parents' rights are and what the patient's rights as a minor child also are. So I just wanted to mention that as well. But again, we cannot support this bill because of all the challenges and issues that would be imposed if essentially the hospitals would not be able to meet these requirements due to the technological limitations. So what I think could happen is the portals would just get shut off, and that's not good. The portals, I think, are a great tool for communicating with the provider, with setting up appointments, and accessing all sorts of information. People really seem to like the portals, but that I'm afraid could be an unintended consequence, and that would be really unfortunate. So, happy to answer any questions.
Are there any questions? Thank you for your perspective.
Thank you.
Yeah, I guess I want to comment on that last statement, which is there are sometimes unintended consequences to adding requirements. In New York City, a number of years ago, for example, the city passed an ordinance that all swimming pools had to have a lift for people with disabilities to get in and out of the pool. That was very costly, ultimately, for hotels that had a swimming pool. A lot of those hotels simply decided to close their swimming pool. So there are, and I'm not saying that's necessarily what would happen here. I ultimately think that this does need to get resolved. I think that if we don't do it in a way that is manageable and realistic, then it could have unintended consequences, or it could prompt some smaller providers to simply go the route of turning off patient portals altogether, which I think would be a net loss. So, my intention is that, I would like to see this get resolved eventually. I'm not, in my comments, I think are if I hadn't said so already, I don't think that this bill is ready to go to the floor for a vote in its current form. Having said that, I think that it is an issue that we ought to keep the pressure on, and hopefully see if it can be resolved at the federal level. If it can't be resolved at the federal level, then state legislation may be in order. I just don't personally feel like we're quite there yet. So to me, that suggests either an ITL or an interim study motion, but we'll have to see what the other members of this working subcommittee think about that. So yes, Representative Cushman.
Thank you. So reading over the bill again, I don't see that it says anything specifically about a portal. And I know we had talked about an amendment to do that. So right now, it looks like this is just in line with the federal law, because it just says release of the records to a parent or guardian. And then it has the carve outs for specific state or federal laws, or if there's a reason to believe it may endanger the welfare of the child, or if the parent agrees to there being confidential communication. So the bill as it stands, it doesn't really address that. And I think it would just, what it looks like to me is that it would put in our state law a guarantee that a parent can access their child's record. And whether that's in paper or the portal, the way it's written now, it's really up to who's providing the record to the parent. Unless the parent asks specifically for a paper. You know what I mean? Do you understand what I'm saying? Like, it doesn't say, it just says that they need access to the record. So under HIPAA, they already have that. So if the parent asks, their child's doctor for that information, and the doctor's office uses a patient portal that doesn't have the ability to let the parent in without hiding that sensitive information, then they have to furnish a paper copy of the record. But that's what it looks like your bill does right now. It just, enshrines that in state law. I just wanted to make that comment. That's all. I don't know what that means for the outcome of this subcommittee, but just wanted to mention it.
Okay. Representative Shapiro.
Thank you. Aside from all of the technical challenges in terms of the portals and electronic medical records, which seem to be significant enough to be cautious about passing a bill like this. I'm also concerned that we're wading into something that's just not necessary. That that HIPAA already outlines what parents have access to, what guardians or parents have access to in terms of medical information. And we're coming at this bill initially from a place of assuming that there's a significant problem because of an anecdotal letter from, I shouldn't say a real letter from a hospital that was maybe more complicated than we thought it was at first. Because when I heard you read that, I thought it was denying parents access. And so I would also say that I just don't think this is necessary. And we're kind of wading into a battle where one side assumes that medical providers are keeping information from families, and I guess I just don't think it's necessary, so I would support an ITL.
Yes,
Representative?
I agree. I support an ITL. I think that we're looking for a problem that is not that significant. There may be some issues with this, but I think basically if my child is having some kind of a medical procedure, I should just have access to that.
Okay.
And so I think that this is kind of prohibitive in my access to things that, so
Thank you.
I think.
So, my own comment about sort of is there a problem is I believe that there is a problem for multiple reasons. One is that it's somewhat alarming for a parent to receive that letter, and it's not just one hospital system that's doing it. It's I have suggested that perhaps some further explanation of why this is being done may help to alleviate some of that alarm, because it seems that the medical providers are kind of being put in a position where they have to be the bad guy, and that's actually not the way I see it now. The way I see it now is that they're subject to regulations which kind of put them in a no-win situation. I would like to see this resolved. I would, whether we do ITL or interim study, or whether someone proposes an amendment to the full committee, I would like to ultimately see this move forward. My sense is that there is the ideal place for it to move forward is at the federal level, or at the at the software companies that are doing this, and I don't see them necessarily investing that until somebody tells them they have to. So I guess my inclination is to say, I don't want to let this issue die, but it occurs to me that the bill, this may not be the right time for the bill, and certainly the short time frame for implementation is just not feasible, I believe, at this point. Yes, Representative
I've lost
Freitas.
my question, but my question has to do with having this resolved, studying this and trying to change. Are we able to do that, or are we better to just ITL and start new with a new proposal?
Personally, that's what I would intend to do if this gets ITL'd, yes. Any further discussion? Yes, Representative Cushman.
Just to like kind of tie up the ends of what I was saying. So that parent, she has 9 children. She went to look up the labs. She couldn't see them that her daughter had just routine labs, but she wanted to know what the results were. She called the doctor's office. They said, no, she's 12. You don't have access to her portal anymore. If you want the records, you have to come in person and get them on paper. So that would comply with this law, or this bill, and it complies with HIPAA. However, I called that office and discussed it with their office manager, and shortly thereafter, the parent had access to the record. So I think it's very possible, if we hold people's feet to the fire, to respect parental rights, and that, you know, it can be done. I understand that there are definitely technical challenges, and that that's going to take some time, because this doesn't really specifically address the portal issue, and it just basically restates HIPAA. I'm comfortable with an ITL,
Okay.
and I support bringing another bill back. You know, watching this issue, seeing what happens, and if necessary, bringing a bill back with a later enactment date.
All right. Yes, we have a motion. Representative Freitas makes a motion to recommend inexpedient to legislate. Do we have a second? Representative Shapiro seconds. Any further discussion? All right. We'll vote on the motion then. Representative Shapiro,
Yes.
Representative Cushman,
Yes.
Representative Freitas, and I vote yes as well. That is a 4-0 vote on ITL. Motion passes. Is there any further discussion? Yes, Representative Shapiro.
I would just like to say there's a, you know, when we're talking about medical records, there's a great variation of information. And I would be frustrated if I was a parent and I was not able, if there was a real barrier put in front of me in terms of getting lab tests for, how old?
She was 13.
13-year-old. On the other hand, in my career as a mental health clinician, you know, I passionately believed in informed consent and parental involvement. I thought of myself as a family therapist, and yet at the same time, there were often delicate issues that were where providing information was incredibly delicate, and I was glad to be able to have some control of how that information was shared. And I spent, you know, infrequently with not very many people, but throughout my career, spent a lot of time, hours, with parents going over their medical records in my office. Their children's medical records in my office, you know, page by page, because I thought if that could be avoided, it was probably better. But when it was necessary, it was really important to do. And so I guess I just want to say that while I voted to ITL, I'm a believer that parents should be involved to get the best results for their kids.
Fully agreed. Thank you. Any further discussion? Okay, with that, I thank everyone for their membership in this working subcommittee. Thank you for your attendance today, and I will close the hearing. Thank you.